Hi everybody, just thought I'd do another little special needs video. This time I thought I would talk a little bit more about teenagers, as my eldest child, as some of you may know, is nearly 17, in fact he's 17 in a couple of months. And he is diagnosed as, well, he has autism and obsessive compulsive disorder, which is a more recent additional diagnosis. A major part of autism, which a lot of people may or may not know, is the anxiety side of things. My son has always suffered with that, right from the age of 9, where he's, the depressive side of it seemed to show up. He would get really low for no unknown reason. He wouldn't even know why he felt it, which is really hard if your child can't tell you why they're there in tears saying they wish they were dead. It's heartbreaking to try and help them. Like I say, this started when he was 9, and I was constantly going into the school, and I was being told, "Oh, we're not seeing any sign of it in school." To them it was completely normal that he had absolutely no friends really. Never went out anywhere. Didn't talk to anyone, throughout a whole day. I thought that was completely fine. Or if they saw him talk to someone once, that was it. He was fine. He had friends. But again, with autism, and the older expert I spoke to had the sense to work it out. A lot of the conversations, because one of the main areas affected by autism is social interaction and social understanding. A lot of my son's conversations were purposeful rather than sort of chit chat or friendly. At one point the school was saying, "Oh, well, Luke does approach." Sorry, I just said his name. I wasn't gonna. Luke does approach dinner ladies in the playground, and when they were questioned further, it wasn't, "Oh, he comes up and chats to them." It was, "What time is it? Is it dinner time?" Yeah, it was all functional. That's it. That's what they said. They were functional questions, and that was a whole side of it. And like I said, at 9, he became very, very depressed. He'd come home and he was hitting himself around the head. He would just cry and cry and cry and not know why, not be able to give a reason why, and started talking about wishing he was dead, which, as you can imagine, was very upsetting. And he did miss, at the point where if he was like that the night before school, and unfortunately the school he was at the time were not completely very understanding, as you can probably tell, and he wasn't being supported in the way he needed to be. So if he got quite bad like that the evening before, the place he felt safest and why he was able to let all these feelings out, which is another very common factor in children with autism. I know I said I'd talk about teenagers, but I'm just giving some background here, really. They only release these feelings, have these meltdowns, whatever they're referred to as, where they feel safe. So a lot of the time that's why the schools aren't seeing what parents are telling them is happening. Which really schools need to be looking at themselves. So that means the child doesn't feel safe enough in school to let their feelings out. Which means we have to deal with it all on our own quite often. So obviously the school told me they couldn't fix, which is an annoying expression, because I didn't need anyone to fix my child. I need someone to help my child. It's not a mechanical thing that needed fixing. He was my son. He is my son. So, I was having to, and it was showing itself in school at times. I mean, my son, Luke, was never someone to even lift a finger at someone, and one day he went and punched 2 other people because they'd upset the person he'd become attached to. He still does it now, at the age of nearly 17. He becomes very attached to one friend. He's completely reliant on them. If they're not in school that day, he doesn't really know what to do with himself. And that's always been the case. Which, again, is why school said, they couldn't see a problem. Because if they asked him if he had a friend, he would name this one person. So they didn't, they saw that's completely normal. Like I say, when he was 9, in the end, he missed school once, a couple of times when these moments were happening. I had my parents see him. My dad, very experienced in the psychiatric area, and he, himself said, "It must have been very hard to say about your own grandchild." He said he needs help. He needs medication or something. To level his moods. So we did. In the end, he was under a paediatrician. When he sat in an appointment with her and told her how he planned to kill himself at the age of 9, she agreed he needed something, because he wasn't, counselling whatever wasn't going to work. If this child didn't know why he felt these things, how could he talk to someone? And he wasn't comfortable talking to someone. That made him more anxious. So he was put on a medication called risperidone, which is actually an antipsychotic by nature. But it was, it was intended to calm down, the anger, the frustration, the upset, make him less likely to self-harm. And it did, it worked. He was on it from the age of 9 until it started to stop working, good English, sorry, at the age of nearly 14. And he was very monitored while he was on this medication to the degree of they would do weight, they would do blood pressure, blood tests, because it can affect, I think it was the kidneys or the liver, I can't remember which, but he had regular blood tests. And he was fine. He never had side effects. So I think his first week of taking it, he was sick once, and that was it. He never had another reaction to it. The stuff was great. Like I say, until sort of just before his 14th birthday, a few months before that, we started to notice the moods changing again, more tearful. Again, not being able to tell us why, but as he was that much older, he'd gone from the odd slap to himself to actively wanting to kill himself. He would run out into the road if we were out in public. He would tell us how he was going to do it. We had a point where we wouldn't let him in the kitchen because we knew there were knives in the kitchen. It got that worrying because he was that much older. And obviously when he was 9, I'd been told by specialists that he wasn't in danger of killing himself because he was too young to ever be left on his own. I have another 9-year-old. I know you can't be with him every minute of every day. In the house, I'm not going to let him go off down the road or anything. So, again, obviously we got towards sort of 14 and he was beginning to get, more aware of things he could do to himself. It was more of a worry. And we'd be at, grandparents' house or something, and the tears would start and he would go and hide away from people. It was really, really horrible, to be honest. And, there'd be no trigger for it. It wasn't... and it was more than, I know people might think, oh, it's teenage hormones. This was something else. If he hadn't been how he'd been at 9 and wasn't on strong medication, I would think, oh yeah, maybe hormones or whatever. We went backwards and forwards to the different paediatrician. I have to say, it wasn't the same person. He'd seen when he was 9 at this point, and they tried upping the medication for a limited amount of time because they didn't want to increase such a major medication, and it made no difference. So we went back, and they still, well, if it's not making a difference, we'll put it back down to the normal maintenance level, and we'll, look into what else is happening. So this was done. We were told he had an appointment Christmas Eve that year, and we were told if he gets worse, if you have more worries, you think he's more of a danger to himself than he already was, ring and you'll get an emergency appointment. Yeah, how many people out there have probably been told the same thing? So of course, from then on, from early January, he did get worse. We couldn't let him go upstairs to watch TV on his own for fear of what he would do. His brothers were hearing him say the most awful things about himself, what he was going to do. It was just a constant worry. I couldn't bear him up from school. He was kept off school at one point because it just didn't feel safe. I couldn't physically take him to school and stuff like this. His brother went with him to school. And then, of course, I did. I thought, oh, brilliant, paediatrician will see him, they'll help him. I phoned and left God knows what messages saying, he is getting worse, I've been promised an emergency appointment, can you please book me in? I was told I have to speak to the paediatrician. He never once actually spoke to me, by the way. Then came back and said, the receptionist, lovely receptionist woman said, I said, I'm quite willing to come sit at the end of clinic, see him right at the end. I just need someone to see him. I need, you've said he needs to see him. I then got a call back. Actually, no, even that particular evening, after being sort of messed about, he took quite a bad turn. He tried to strangle himself, with his hands, and was making all sorts of threats. And my husband was home, and he had, he sort of calmed him down as he could. It took ages to calm him down. And he decided he was going to take the next day off work, and we were going to go up to the hospital, sit there until the paediatrician saw him, whatever it took, because this was obviously getting really serious. And I tried again, phoning the paediatrician in the morning, telling him that we'd had a really hard night with him. He needed to be seen there and then. We'd both taken time off work. He'd been kept off school. A desperate call. And again, receptionist obviously went and spoke to him. He didn't feel important enough to come and speak to us on the phone, let alone see us. And the message we relayed back was take him to hospital. Sorry, power cut out for a sec there. Yeah, we were told take him to hospital, sit in A&E with him, or get him to see your GP. So of course we phoned our GP. Again, we weren't able to speak to our GP. We were just told, the receptionist again went and spoke to him, came back and said he needs to be seen as an emergency in hospital. So we took this child, who was not even 14 yet at this stage, I don't think, or maybe just turned 14 by then, in a state already, and had to sit in our local A&E department in total 6.5 hours. This was with him sitting there bashing his head off the walls, by the way. This is how distressed these children can get. He saw the nurses. I can't fault them. They were lovely. They were doing everything they were able to do. It's they're not specialists, in any way, shape or form, and they can't all be. But they obviously had set questions to ask someone when they believe it's a mental health issue, and it was along the lines of, when you think of self-harming or killing yourself, what do you think of using? Have you thought of using weapons? I mean, thinking back now, I think, God, just give them a list of ideas. But it wasn't handled the best way, right the way from the beginning, right from our paediatrician right the way through. It wasn't handled right in the right way, and I think it's because not enough is known about mental health in teenagers. There's just not enough known about it, let alone autism connected to it in teenagers. There is no enough research being done into this. So, as I say, we had these 6.5 hours, them getting more and more distressed, and the hospital, I don't think they knew who they needed to speak to. In the end, they were speaking to a mental health clinic, like, one of these child and family adolescent places that he'd been seeing when he was 9, and I had told them all this. I told them there were people there that knew his history, and eventually they were told to move him to the children's ward. This is obviously at the children's A&E. They said admit him to the children's ward, and someone would come from a little bit further away, further into town, from this particular centre, and would come and see him themselves. Like I said, by then it was 6.5 hours in total going through this. So he was shaking. He was in a horrible state, and he's quite openly telling these nurses at this point that he didn't know why he wanted to die, but he wanted to die, and it was just awful time. So we went and we sat in the lovely children's ward. Then he was terrified he was going to have to stay in hospital, so we had the upset of that, because they'd said it in front of him, he may have to stay overnight for a few days for monitoring, and he'd completely said that he wasn't doing that. I'd sort of talked him through. I said, I'll stay with you, how long it is, I will stay in hospital with you, it's fine. We looked at all the positives, had a PlayStation and all this sort of stuff, things a 14-year-old boy might be interested in. And then the psychiatrist came. Bless him, and he's a really nice gentleman. Took me and my son. I think my husband had to go and feed the meter or something at some point, or there was whether it was maybe sorting out something for our younger children. I can't remember. I know I was on my own with my son when the psychiatrist came, and then my husband joined us a couple of minutes in, and my son was again very distressed. The psychiatrist noticed it straight away, and he was talking. The bit I haven't said, actually just realised, about the fact that my son was telling them that the reason, all he knew about why he wanted to kill himself, is the voices in his head were telling him to, and he was getting visions in his own head of his death. And psychiatrists immediately sort of talked to him about these, and decided that the voices were not voices; they were more powerful thoughts. And with this, that connected to the visions that just kept popping up randomly, he diagnosed him there and then with OCD, which is obsessive compulsive disorder. And he said this is separate from the autism diagnosis. So the anxiety he was feeling was not just because he's autistic; it was a whole separate diagnosis. And on the spot, he said, "Well, the medication's clearly not working anymore. We need to change. He needs to go on to I think it's called fluoxetine. I can never pronounce medical names properly for some reason, but I think basically he told me that it's a form or another name for Prozac." So he put him onto that, but obviously the medication he was on was strong, so you had to taper it off. You couldn't just stop it dead. Never ever stop anything like that dead, because he would just go downhill. So we were given advice how to do this. He was also very concerned that Luke wasn't sleeping, and Luke has always been, again, I was told it's connected to the autism. It's very, very common for children with autism to have sleep issues. But no matter what time he goes to bed, and it's still the case now, You know, we could stay at a family event or whatever, or, you know, if you're on holiday, you stay up like majorly late, and he will still get up every single morning, 5:45, up and about for the day. He'd be knackered, look a wreck all day long, but that's it, he's awake for the day. And this concerned the psychiatrist, and they gave him there is a hormone, I can't think, begins with M. I want to say meconium, but it's not. They gave him that, and they gave him some actual sleeping tablets that we could give to him for the next few days to try and give him extra sleep. But these tablets literally would just help him sort of stay asleep, you know, go to sleep. They never really helped him stay asleep. He could wake up, even on proper sleeping tablets, he would still wake up 5:45. It's just something he seems to do. And they've eventually given up with trying to fix that. He just, you know, he does have these tablets if he wants to take them, but then they just help him fall asleep, they don't help him stay asleep. So, a bit sort of pointless for him, really. He just has it as a crutch. Sometimes if we're staying at someone else's or if we're on holiday, he likes to take one then to have him go drift off. So we were sent home because, you know, he was too upset. The idea of staying in hospital was causing him more anxiety. So, you know, psychiatrist said we could go home. He saw him regularly. He's been seeing him now. I mean, like I say, my son's nearly 17, and he's been seeing him regularly still, and he's still on the fluoxetine. He was also given it's called CBT, which is cognitive behaviour therapy, which is more giving him strategies because of his age, I suppose. You know, how to cope. I mean, it's a great thing. You know, again, it's helping him. He has to try and remember the strategies, which is another issue there. But it sort of helped. I mean, like I said, they kept him on the medication. He was being seen. I mean, now I think he's currently seen every 3 or 4 months by the actual psychiatrist. But he's still on, you know, the medication anyway, and I can ring them. I hopefully believe, you know, if he took a turn tomorrow, I could ring this psychiatrist and he would see him. It's not a case of what happened with the paediatricians, which won't ever happen again. I have a whole other issue about that. So, you know, cognitive behaviour therapy, he was put in for a block of that with a clinical psychologist. I think she was actually sort of still in training a bit, but she was excellent. I can't, you know, fault her. She very sweet to him. He liked her. He found it very hard going to the sessions because he didn't like the fact that he had to stay in the actual hour session on his own. He still, even at his age, finds it very hard and prefers me with him. And it's not that I've been whatever you call helicopter parenting. You know, I've tried every chance I've had to give him the independence that, you know, I'd like him to have, but it's not that easy when your child has these difficulties. You know, you get told by everyone, oh, you should be, you know, they're growing up now, let them have independence, and balancing that between meeting your child's needs is so hard, and that's something I'm struggling with as he gets older. You know, where's the line? Where are the boundaries now? You know, it's not easy. And I can only see that getting more of a worry as he gets older, to be honest. So yeah, he had the block of the, you know, cognitive behaviour therapy, and that was just before he did his GCSEs. That ended just before then, so it was earlier this year he did his GCSEs. And obviously one of his big areas of stress is things like exams. I think it's anything that's around school, to be honest, because the hard time he had through primary school, things like that. I think, you know, that's what the psychiatrist believes too. So he was kept on the medication. He was seen quite regularly, sort of in the build-up to the exams. We tried all the therapy, you know, the remembering things, making charts, making lists, just constant. And I mean, the school, because he was statemented, he, you know, I don't know, I think I talked about it briefly in one of my other blogs on here. You know, we've fought for the statement, and due to that, he was able to put in smaller groups for his exams. He was given extra time that he never once used because of how he is. If the exam is an hour and 45 minutes long and it says that on the paper, that's how long he will have. He doesn't use the extra time, but he's still entitled to it. You know, they always gave it in case, well, probably in case I kicked off and went on and had a rant, but, you know, in case he needed it and needed a toilet break or whatever, he had that extra time to sort of play with. And the exams were stressful for him, bless him. You know, they are for anyone, but, you know, you throw anxiety and the other issues into that as well, and it's, you know, I hated my exams, but to be as anxious as him and go through them must have been horrible. And then with him, the difficulty was once the exams were done, you then had the long wait for the results. I mean, he finished his last exam was middle of June, and the results didn't come out until nearly the end of August, which is a hell of a long time for anyone, but for him, who's obsessed with time, it was hell. And I have to have a proud mum moment here, because I've talked about his exams, so I may as well talk about the results. He came out with an A in sociology, and 5 C's, including maths, English, and science. I've got goosebumps when I think about it. We went within a day to open the envelope, and I actually cried. And I've always been one. I've not cried in front of him. I've tried to stay strong. I've let him know. I've been upset about things. And he knows. I'm human. But I just couldn't stop myself. And he'd been planning. He was going to go to college. He wanted to do BTEC in health and social care. I thought that's really what he wanted. The day he opened that envelope and saw his results, he turned and said, "I want to go sixth form. I want to do A levels. My results are better than I thought they'd be." And that's what he's doing. He's now doing A levels. Again, as you can imagine, it's not easy. And he's been recently reviewed by a psychiatrist, and because of the level of stress he's put himself under. And again, I'm very, very torn. Old college would have been an easier option in that there was more learning support offered by the local college than he will get in sixth form. Again, I think probably due to sixth form cuts. Thank you, Mr. Cameron. Cuts for post-16 education are not good. When you're told, the school don't have the money for books for the child to write, and you have to send them in with books because it's sixth form. A little bit. Sorry, I'm getting off course here. I'm turning to my father. He was reviewed, and it was decided to keep him on the medication, and that was a two-edged sword, because when I took him to that review, part of me was absolutely terrified that, because they're eventually going to want to take him off the medication. I accept that. But the big fear, obviously, is what if they take him off it, and he just goes again, and we have, there's always the fear that he's, gets stressed. He still does get stressed to some degree, but there's the fear of him going as downhill as he was, where we really, really felt he was in danger of doing something quite serious to himself. And the medication is what saved that, stopped that happening. I firmly, firmly believe that. So there's the fear of what if they take him off it. But then you go to the appointment, and it's not even mentioned the option of taking him off it. Straight away, it's we'll just keep him on the meds as he's on. We'll review him again. We'll see him again in 4 months. I'll write letter to your GP, tell him to keep prescribing these. And you sort of go home and you think, oh, so they don't really think he's capable or well enough to come off the meds. And it seems weird, because that makes me sound flipping, I don't know, does it make me sound like a bad person? I hope not. I don't choose for my son to be on medication, but I feel so strongly for anyone, whether it's a child, adult, whatever the condition is, if the medication improves your life, your quality of life, in whatever way, there's no shame in popping a tablet in the morning. There's still these big taboos about taking antidepressants or whatever, and I think it's got to be better than being so unhappy and anxious all the time. So again, I know I'm always going to have the worry that they are going to eventually say, well, we'll try him without it, and we'll tackle that when it comes. But at the moment, he's doing okay. The school did suggest he take 3 A levels rather than the 4 that you have to take, and again, because of how he is, he point blank refused. He said, everyone else is doing 4, I'm doing 4, and he is, I must admit, he's struggling. He's now been doing it a few months, and it's hard. It's a lot of work. I never personally did A levels because I didn't really do well enough in my GCSEs at the time to be able to do A level. And I know they say after a year he can drop one anyway, but which is the only way he'll do it. If everyone else is dropping one, he will. He won't let himself be different in that way, which is good. It's everyone's going to say it's good, it's confidence, but it makes it harder at times to help him. He's quite stubborn in that way. So for now he's doing well, but really, like I said, what I wanted to talk about is that there isn't enough understanding or awareness of mental health in teenagers, let alone connected to autism. And whether they seem to think. One of the questions when he was assessed and diagnosed with OCD was about bipolar. Is there bipolar in the family? Well, there's no one diagnosed in my family. There could be people who have it. There could be people not diagnosed quite easily. But whether I can see why it's hard to diagnose any of these things, because there are so many crossovers. I can see elements of what could be considered bipolar in him, and part of me has always said, since I've been doing my research, that when he's an adult, that may be what they change the OCD diagnosis to, which apparently happens a lot. But as long as I'm able to do the research and ask the right questions and get the right help, we'll go along with how things are now. So again, any questions, anything I can help with. I'm not by any means a medical expert. I can only help with my own experience. I'm not a doctor or anything, if you have major concerns, I would always say push for assessment. But if I can give any advice in that way, please leave a message, subscribe if my blogs are interesting you. Good luck to everyone with your own situations and your own families. Thanks for listening. If I haven't gone on, I've noticed I've gone for about 25 minutes again. I'm sorry. I tend to talk a lot. So I haven't sent anyone to sleep out there. Thanks for listening. Bye for now.